PHI Hospital SVETI VRACEVI BIJELIJINA provides secondary and partly tertiary services. It covers the northeastern part of Republika Srpska and is the only hospital within a radius of 60 kilometers with about 200,000 inhabitants. Our services are also available to other healthcare users who require these services in this institution. The hospital has more than 630 employees, 180 medical doctors, more than 100 specialists, 20 subspecialists, about 300 nurses. The hospital employs 18 university professors. We have 8 departments and 11 services, 7 operating rooms and an angio surgery. Hospital management, headed by Dr. Zlatko Maksimovic, PhD, turned the crisis caused by COVID-19 into an opportunity. We have shown that we were more willing and able than many others to respond adequately to it. We made the right decisions at the right time. From the beginning, we treated COVID patients separately from the non-COVID patients. One of the key decisions was the opening of a new COVID hospital in October 2020, thus expanding the hospital capacity by 40 to 50 patients. The new K2 COVID hospital has 2 equipped operating rooms which provide conditions for performing surgical procedures on patients positive for COVID-19, childbirth, emergency surgery, traffic accidents, injuries, etc. in situations where you cannot wait for the PCR test. In these rooms, patients from other municipalities were also operated on. At the same time, the polyclinic was moved from the new hospital to the adapted building of the surgery, where citizens are provided with consultative specialist and subspecialist healthcare services. This reduced the possibility of introducing the virus into the non-COVID hospital building to a minimum. It turned out that COVID-2 hospital was opened just at the time when it was necessary and when the arrival of the autumn days drastically increased the number of patients who required hospitalization. In November 2020, when the number of patients reached its peak, we asked the city crisis headquarters for approval to expand capacity in Banja Dvorovi 3 kilometers from the city of Bijeljina, thus enabling admission for additional 100 patients. There we accommodated patients with less severe clinical pictures as well as all patients from COVID-1 and 2 whose condition stabilized. This freed up space for the reception of critically ill patients in COVID hospitals 1 and 2. Even much larger institutions did not have such an organization of work at the time of the pandemic. The hospital's crisis headquarters holds short but effective morning meetings on a daily basis, at which decisions on further actions are analyzed and decisions are made. The crisis staff of the hospital organized monthly meetings with primary healthcare, all with the aim of better and more productive cooperation in the treatment of patients with COVID-19. In our COVID hospitals, mostly volunteers worked, as well as the members of the hospital administrations, lawyers, economists. It is extremely important that in such difficult conditions and in such positions there are people who do their job with will and optimism. The speed of capacity expansion was accompanied by quality, as evidenced by the introductions of ISO 9001-15189, Quality Management System and Risk Management System. Our goal was to strengthen the management structure of our hospital, to teach our chiefs that they can overcome the crisis if they learn to organize properly. And we were right. The central building of the hospital remained a non-COVID hospital. We never allowed mixing of COVID and non-COVID patients. We always had enough free places for COVID and non-COVID patients. All the time since the beginning of the year, we have been working on a complete elective chronic program and raising the number of provided services to a level higher than before the COVID pandemic. The 24-hour work of the angio surgery was introduced. The Center for Hypertension, Stroke and Heart Attack Prevention was opened. Then we have new procedures in surgery, TEP method of laparoscopy, in urology, lithotripsy, orthopedics, revision knee prosthesis, cardiology, pacemaker implantation, ophthalmology, state-of-the-art cataract surgery, phaco. Improved diagnostic work, especially endoscopy. We regularly cooperate with eminent health institutions in the region whose experts work on the education of our doctors, and we are also able to communicate with world experts. It is difficult to cover all the events during the COVID-19 pandemic in the Hospital Sveti Vracevi, so we recommend the book Our Struggle with COVID by Dr. Zlatko Maksimovic, PhD, the director of the Bijeljina Hospital. To our knowledge, this is the first monograph of this type in Europe. It was published in June 2021 and has been printed so far in 3 languages: Serbian, English, and Russian. The book is intended for professionals, but also for the general public, with the aim of providing information on the contribution of public health institution Hospital Sveti Vracevi Bijeljina in the fight against the COVID-19 pandemic. The monograph is a combination of science and profession in the field of health management, epidemiology, and infectology. The reviewers are prominent experts in the field of infectology and epidemiology: Dr. Goran Stevanovic, PhD, member of the crisis headquarters of the government of Serbia, director of the Clinic of Infectious and Tropical Diseases of the Clinical Center of Serbia, and Dr. Biljana Milovic, PhD, Vice Dean of the Faculty of Medicine in Foča, University of East Sarajevo. They point out that the book can serve the future generations to gain experience in combating future pandemics.